You are listening to The Scope, Phelps Health's podcast, episode 1. Today we're talking about COVID-19 and the mental health curve. Let's get started. Hi everybody, I'm your host, Paige Heitman. Thanks for joining us on this new endeavor as we break down barriers in healthcare. The Scope podcast is produced on a regular basis and can be found by visiting phelpshealth.org. Come back often and feel free to add the podcast to your SoundCloud stream or subscribe to our YouTube channel. You can also follow us on Phelps Health Twitter, Instagram, LinkedIn, or Facebook. All the links are in the show notes. Now let's get started with our show today. Today our guest is Dr. Forrest Rackham, a clinical psychologist with Phelps Health Medical Group. So Dr. Rackham, go ahead and tell us a little bit about yourself.
I'm a clinical psychologist working in a variety of settings with Phelps Health. I am able to work in pediatrics, working with other medical professionals, working as part of a treatment team, and also at the center clinic, providing treatment to other individuals, including adults and children.
Awesome. So where'd you go to school at?
I went to school at Georgia Southern University, where I got my doctorate. Before that, I went to Bowling Green State University.
So not Missouri.
Not Missouri. No.
That's pretty unusual. So you chose Phelps Health for a reason. Let's talk a little bit about that as well, because I think that's pretty unique.
I believe in Phelps Health. To be honest with you, I see a lot of growth and potential with Phelps Health. And when I was looking at different organizations with whom I could work, I saw Phelps Health and I kept on feeling gravitated toward it. Also, I believe that there's a lots of room for growth. I believe that also there's a lot in which we can be able to offer our community.
Mm-hmm. Do you think that's because we're a rural community that we're so special? Because we're not like St. Louis or Kansas City. What we have to offer is really unique.
It is. I have been trained in working in rural communities. Part of the program at Georgia Southern University was rural psychology.
Okay.
And so in saying that, when I was looking around, I was looking for small towns, roughly about the size of 20,000 people.
Yeah.
And that still had a burgeoning area where they could be able to provide to our rural community.
Wow, that's really impressive. Well, I know we are very lucky and really grateful to have you here. You've been on our radio show, Ask a Professional, dozens of times probably. So this was, like I said, kind of a natural fit to have you on our podcast as we begin to roll this out, because we thought you would just be perfect, and you're a clinical psychologist. So if we just butcher this, you can talk to us about it later.
Exactly.
So I know today we're going to talk about COVID-19, but we're not just talking about flattening the curve itself. We're talking about what people are calling the second curve, which is the mental health curve, which is kind of cool and also kind of scary. So what are your thoughts on that?
Well, I was recently just talking to my wife about this, and it seems as if, through my experience, a lot of patients are hunkering down.
Mm-hmm.
Whenever there's a lot of turmoil, or whenever there's chaos going on, or just uncertainty,
Yeah.
People seem to pull in on themselves.
Mm-hmm.
And then when things start to die down a little bit more, when things become more normalized, that's often when people are more likely to seek help. And so when that comes, that's when they'll more likely seek mental health services due to kind of the lack of services that they've had while during quarantine or during isolate in place.
Now, something that I've recently read from Burrell Health Center, which is located in Springfield, Missouri, is that I think 55% of Americans either have a concern for themselves or a concern for a loved one. So whether that's like a friend, a family member, or a neighbor, there's a real concern around mental health right now. Yeah. So I think within 1 to 3 years, we're really going to start seeing an influx of people who say, I want to talk about my mental health because I think I'm not okay.
Yes, and I love the services that Burrell Behavioral Health, I interviewed you there at one time.
Oh, okay. Well, I'm glad we stole you.
I know. And they have tremendously great professionals that work there.
Mm-hmm.
They were able to provide us a lot of that information. Recently, Kaiser Permanente, who also is a big proponent of mental health services, has also identified similar percentages of people who are also concerned about mental health too.
Wow.
And feel as if it's roughly about 49 to 55% of people who are feeling as if they are affected mental health wise with the things that are going on with COVID-19.
Yeah, well, I know addictions, people who are relapsing.
Right.
We have people who are in domestic and family violence situations. I myself am a CASA advocate right now, And I know the reporting is going underreporting right now, which is really kind of scary for a lot of people, because what that means is that there are children who are in homes where they may or may not be being abused, and so mandated reporters who would be like teachers, counselors, like nurses who would see these types of things, whether it's like bruises or a child that is sick or doesn't want to do their schoolwork. Those things are going unreported right now.
They are largely going unreported. As you're saying, the natural structures in place that are there for them, like school and school attendance,
Yes.
and being able to see all those multiple different mandated reporters definitely helps out for them to be able to be reported or to have those services there.
A lot of people are out of work right now, but Phelps Health is in a really unique position where we're not out of work. A lot of people are still coming into work, they're working different positions, different departments, and along with that comes all of these new stressors and anxieties.
Right.
So how can people deal with those different stressors and anxieties that they haven't dealt with before?
So we got really, I'm hearing almost two groups of people. And if we think about it, we can think about it as four. People who are natural, everyday, people who are still able to go to work because they're necessary workers. They also are experiencing anxiety because they're having to go out in the work field and possibly be exposed.
Yeah, well, and then they risk potentially exposing their families.
Exactly. And then we have the frontline workers who also are concerned about potentially affecting their families. And then the people who are at home and are not able to get out and are not able to do that because of quarantining and or because they're not an essential worker or whatever. So talking about those things, really the things that we have found is that the most common characteristic amongst all those things that we're talking about is change. And research has indicated that the biggest contributor to stress in general, is anything that is change or that is uncertain or that is outside of our control. And so even with the people that are having new job details that they're having to go through, practicing acceptance of change, and there are a wide variety of different ways of which we can do that, but practicing acceptance of change and recognizing that this is only going to be for a short time, and the whole host of things is still going to be a short time, can often help offset it for other people. Also, change, whenever we have uncertain times like this, it actually puts us in a unique position to start new behaviors, to start new trains of thought that we would not have normally thought of. When we're getting in the regular routine of everyday life, we often go on automatic pilot. We often don't think about how we are interacting with other people. But with levels of uncertainty the way they are, and with the levels of change the way they are, we can create then new opportunities for connection with other people. We can also create new connection opportunities with ourselves and engage in healthier habits that maybe we hadn't considered before. Or maybe because we're in a new position, now I get to meet some other people that I have not been aware of before. So we can look at some of these things as possible areas in which we can develop growth. And so we can look at it more as a kind of a growth mindset rather than
a scary thing.
A scary thing.
Yeah, instead of jumping off a cliff into the unknown. Recently, I listened to a podcast by Brene Brown. She started her own podcast series called Unlocking Us.
Yes.
And one thing that I really pulled from it is she said, relationships are the foundation of dialogue. So I think we're in a really unique position right now to have a dialogue with ourselves and to create a relationship with ourselves, because a lot of us have these feelings of anxiety and isolation because we may be alone or we may not be connected to people the way that we thought that we were.
Exactly. I know that when people are feeling isolated, the best thing that they can do is broaden and deepen their relationships with other people. And so we can do that in a wide variety of different ways. As Brene Brown has emphasized in different venues, she has emphasized that we need to practice being vulnerable. And so sometimes as a leader, I recently was in contact with one of the leader of our organization, and he was saying, how can I be able to help out my staff, who I am concerned, and I want to be able to help them out as best I can. And as he and I were talking, the thought kept on coming to my mind. We can model that best as leaders by being vulnerable ourselves. And by even reaching out and saying, I'm feeling a little bit anxious. How are you? I'm wondering how you're feeling at this time. Because I noticed that maybe you seemed a little off, and I wanted to let you know that I'm here to talk to you about it. So that in that regard, you're deepening that relationship by being vulnerable and by sharing with them a little bit of your anxieties, and then you're allowing that other person then to speak to those anxieties too. And then broadening is by getting in contact with more people. Some people have said, I've not talked to some people since high school that I'm reaching out to recently than I have ever at any other time. And so it can actually help out. That's one of the things that can help out most, is broadening and deepening those relationships.
Yeah, we're almost reaching into a new normal,
Right.
where I think we've realized that we're very social beings, and that connection is very much a core part of who we are.
Right.
So as we go and we try to find this new normal, what do you think a future shaped by coronavirus looks like?
In cultures where there's a lot more trials, when death is more pronounced, where you can see it almost, those cultures are also more closely related. They're also more likely to reach out to one another and be more open even about their emotions.
Yeah.
I think that it could go either way. What I hope would happen is that by all of this sharing in this experience, it could be something whereby we can also uplift and share with one another our thoughts and feelings. And if we're thinking about restructuring how things could go, I think in some regards some people are going to be more careful in terms of how they interact with other people, because they might not want to spread things to them in the future. And also, there's a potential for people to be able to reach out in love and service, in a wide variety of different ways. There's the other way in which people could go, which is that they can close in on themselves more and see anybody else as having any kind of disease as something to be shunned or backed away from. Or we might even blame systems that are in place to help us. We might even blame them because they didn't protect us adequately enough. So it could go in a wide variety of different ways. I really hope for more of the positive.
No, I completely agree with that. I recently heard this other thing called mode of attribution asymmetry, which is where we come from this belief that everything that we believe comes from a place of love. And everything that people who don't believe the same thing as us, they are grounded in hate. And so I think to kind of echo your point, we could go one of two ways. We could really come out of this and we could be a better society for it and a better community, which I think Rolla is really going to come out on top of the mountain when all this is said and done. But I think other communities, they may struggle because they may wind up butting heads from this because it may become too political.
Yeah, it could very well get that way. Thank you very much for sharing that.
Yeah, absolutely. I think it's really interesting that communities like Rolla come together during situations like this, and they really want to do better for the people around them. And you don't realize that until something as serious as a pandemic occurs, that the people around you really do care. So something else that I thought was really interesting, and maybe we could talk about, is that Phelps Health has kind of rolled out these televisits.
Yes.
So I'm not sure if that's something that your department has come into contact with yet, with visitor restrictions. Could you talk a little bit more to that?
So the biggest thing that they've emphasized almost from the very beginning is limit contact as much as possible. And that also applies to behavioral health. In regard to that, we have been offering those services to other people. And a lot of comments that I experience from patients is, I would love to be able to visit in person. Nonetheless, if this is what I get, I'm fine with that. I'm grateful that I'm able to still visit. And so those telehealth visits can also provide an adjunct in the future, I think, if people are not able to reach out or if they're not able to come to their appointments physically. And so the telehealth visits are great. A lot of people feel connected, and a lot of people feel like they're getting some of their needs met. Yeah,
well, do you still feel like there's a stigma in mental health too, with this mental health curve, that people see somebody say, well, I'm anxious or I'm depressed or I'm nervous, and they automatically associate them with somebody who's less than. So maybe with these telehealth visits, somebody can call in and they don't have to see somebody walking into a clinician's office.
Yes. I find that could be a way to help destigmatize a lot of the problems that people have with behavioral health services, because a lot of times they don't want other people to see their car at a clinic or anything like that, and they're able to do it from the privacy of their own home if they want to, or the privacy of their own car, wherever they're at.
Absolutely, which really very much helps that stigma itself, but at the same time, how do we get rid of that stigma? You continue to talk about it, right?
Right. Well, one thing is having prominent leaders talk about it, having people who are publicly known in the community talking about it, helping redefine what mental health is and behavioral health is. So I often refer to it as behavioral health rather than mental health.
Yeah.
And the reason why I do that is because I often view mental health or mental processes in our brain as part of the whole behavioral construct.
Okay.
And so our behaviors are encompassed with emotions, are encompassed with thoughts, and are encompassed with the social construct of what we're experiencing at this time. So if we think about it more broadly as something that's affecting our overall behavior and our overall health, I think then people are more likely to see it as more destigmatized. Because when you think of mental health, often people are like, oh, he's mental, she's mental.
Yeah.
Or mental illness. And all those things are mental illnesses or illnesses per se. But to put it down to just a mental health, I think we are missing the mark. I think that there are different components. I've visited with other patients who, as some of the situations have resolved, then they have noticed that the depressive symptoms also resolved. So sometimes it's more about situation. Other times it's that they have a lot of thoughts of downing themselves, where they are talking mean thoughts about themselves, they're bullying themselves. So when we address those thoughts and how they can interact with those thoughts differently, then oftentimes their symptoms also get better. And so I think we have to look at it from a whole constellation of things. And that's why I'm prone more to call it behavioral health. And so I think if we emphasize that more to other people, then they're more likely to get behind it.
Yeah, you change the conversation.
Exactly. A couple of the special populations that I love working with are sometimes people who work in farming. Farmers and other people who work with animals, often if you refer to it as behavioral health, they get it. Because when they think about animals and animal behavior, they are often able to think about how they can move the animal to a different location. And they can notice the animal's behaviors. They can say, oh, this one's about to have a calf pretty soon here. And so by also using behavioral health, people can connect with that a little bit easier too, because it's tied with the word behavior.
Yes, so they think if they change their behaviors and their actions, they can positively improve their lives.
Right.
Which makes sense.
Yeah. So that's only one way that I think of in which we can decrease stigma, is having leaders and other public people talk about their experiences, and also changing how we view and talk about behavioral health in general too.
Yeah, that's a really great note. So for all of our listeners, anybody who is referring to it as mental health, which I even did at the beginning of the show, we've all learned something from this. We now should probably start referring to it as behavioral health, because I think that's a little bit broader of a range, and it gives us the opportunity to have a better discourse with people,
Right.
which is really awesome. It gives us an opportunity for chance and for change,
Right.
which is awesome. That's what we want. Dr. Rackham, a lot of people hear the word essential employee, and they don't really know how to feel about that. I know a lot of people who aren't essential, they may not agree with it. They may want to be essential or feel like they're essential. What are your thoughts on that?
You've seen some of the memes where some people are showing a person that has the essential worker on it.
Yes.
And it shows them like walking in with sunglasses on or something like that, because they're like, yeah, I'm cool. I'll tell you, for the people who have been identified as essential workers, for some people it kind of feels like it's a boost to their self-image.
Yeah.
And they're like, yeah, I'm contributing in some way. So in some regard, it's like I'm contributing. Other people, I don't know if they even care if they're an essential worker. They are just happy that they get to continue going to work. For those people, and that's it's good that you asked that question, not being identified as an essential worker can actually be a blow. And there have been quite a number of people who have identified times in which they felt unneeded, unwanted. And so I can imagine it really is affecting how they feel about themselves.
Which is very detrimental to COVID-19 and the mental health curve. That's part of it.
Exactly. Yeah.
So how do you think those workers who have been identified as non-essential, what can they do to kind of boost their self-esteem? Because they're not working right now. They're at home sitting with their thoughts.
You know, that's a hard one, because with not being a non-essential worker, you also have the problems with finances. You also have the problems, despite the stimulus package that has been signed into Congress and sent out to many people. I imagine if I were in that situation, in which I have been in situations in which I did not work, I was not able to work, I spent more time reading, I spent more time talking to people, I spent more time focusing on the things that I could control, and disregarding things that I couldn't control. And as I did that, I found I experienced more peace of mind. And then I also found different ways in which I could work or hustle on the side to be able to find work. People can get creative, and as they're getting creative, they will find other ways in which they can work, and they will be able that they can be able to provide for their family or for themselves.
I think you hit on a good point. I think it does take a little bit of creativity and maybe getting back to your roots to find a little bit of simpleness and maybe a little bit of joy out of that.
Yeah.
Because I think whenever we get back to those things that make up our essence of who we are, maybe we can find a different way to re-enjoy our lives and reinvigorate our lives. Because by necessity, we could find a new innovative way to work, like you said.
And I think by doing that, it can help out. Now, at the same time, there's still going to be people that do even their best efforts.
Yes, it still won't pay the bills.
They still won't pay the bills, and so that's going to be hard. And I think that's at that point. Sometimes it's not about them. It's about us helping them out, to lift them up out of those situations. So I think that in some regard, we need to be able to be forgiving and also compassionate to those people who are not identified as essential workers and who are going through financial hardships, and also find ways in which we can help buoy them up when we are able to, because they'll need it. And the more we're willing to help other people out, the more that the community will get strengthened, and they can feel like they are essential. Because even though they're not termed essential workers, every human being here on this earth is an essential human being. And we should do what we can to be able to provide as much support for them as possible without taking their own autonomy away.
So as we work against the grain to kind of flatten the second curve in the midst of stay-at-home orders, social distancing guidelines are at stake. Same thing with like job loss and economic uncertainty. So what are some things that we can do to create some normalcy in our life? I know everybody's lives have been very much upended.
Yes. I was talking to a doctor the other day who was visiting with the patient. Both of the parents are outside the home because they're essential workers.
Yes.
So they have young kids at home, or a young child at home, or a teenager. And as we were talking about it, the doctor and I had thought, well, maybe it might be best if we encourage the mother or the father to set up a schedule. Even if it's a loose schedule, a routine, that then the child or the teenager or whoever's at home could follow. And so we find that when people are regularly on a schedule, as tedious as it could be sometimes, it can really help you know what to anticipate in a time when it's difficult to anticipate change.
Does it help calm our brains, or what is the psychology of that, I guess?
Yeah, it does, because part of the time in which you feel there's uncertainty, it gives you something certain. I know what I'm going to be doing at this time, and I know I'm going to, after I get done with that, I'm going to do this. And so having a routine, having a schedule, that's one of the best things that we can do. The other thing that other people have been neglecting is people who are staying home now are tending to stay up later. And so keeping to a regular schedule and making sure you're able to get some good sleep so you can be able to sleep well, because we find that when people do not get enough sleep, anxiety and depressive symptoms go up. So one of those things, again, regular schedule, nighttime, daytime, wake up, roughly about the same time, and then also schedule your activities throughout the day. The other thing is to schedule pleasurable activities. Some people are really having some times when they are very social gatherers, and so having a Zoom dinner with one of their friends can be very helpful. I see one of my friends on Facebook who regularly has dinner with his friends, and they're always having a great time. He's the one that sets it up, but as he sets it up, still people are very appreciative. They get to share in the meals, they get to share in laughters.
That's really fun. You know, one of our coworkers, her daughter, they did a huge happy hour. And I guess everybody had their own drink, whatever, and somebody would take a drink, and then they would pass it, like, through their own video chat, whatever, and then everybody took a drink. And that went on for, I don't know, however long they wanted to drink, I guess.
Right, yeah. But again, it's the social gathering. It's the social connection. Sharing in those things that we would normally do, and just be creative about how we do it. And if we are creative about how we do it, it can really open up some opportunities for us to connect in different novel ways. And in the future, they may very well look at it and say, that was a fun experience. I'm going to embarrass myself a little bit if I can. There was a time in which I had to live up in Burlington, Iowa, and my family was living in West Plains.
Oh, is that what it was, Iowa? No.
Yeah, it was Iowa.
I'm kidding.
That's the embarrassing part, right? But as we were looking at different places we could live, we found Rolla, and we found Phelps Health. So as we were getting closer to it, during that year before we got there, we had to live separately in different locations.
Okay.
And so we would eat dinner together. We'd play games with each other over the phone for FaceTime, wherever.
Yeah.
And there were quite a number of times in which kids saw me embarrass myself several times, and so they all got to share in the same experiences over and over again.
So they're very familiar and comfortable with video chat, phone calls. They've been there, done that with you guys.
Yeah.
So COVID-19 is nothing new to them.
Nothing new, but at the same time, they're missing their friends.
Yes, absolutely. Well, and I know that you kind of have, you have a van load of children.
Yes.
Right?
Yeah.
So a question that I wanted to ask you, if you don't mind, is how many classes or grades are you now qualified to teach?
To be honest with you, I think that would go up to my wife. Julianne is at home with the kids almost all day, and so I think she's more qualified to teach all those grades. So I think that's about 5 grades that she could.
Wow, that's impressive. That is very impressive. So kudos to your wife. That's amazing to me. I know that's been a huge achievement for a lot of parents because they're working double time now. So for me to see parents coming home and doing all these huge, awesome, amazing assignments with their kids, I just think that's really cool.
It is really cool. What's cool is that nowadays we do have technology. And what's cool about nowadays as well is if a parent does not know how to do it, there is a YouTube video out there about how to approach it.
And somebody else can teach them, like Khan Academy. I mean, that got me through college.
Exactly, yes.
When the professor couldn't, Khan Academy did.
Yeah, and a lot of people look at the Khan Academy because it is a great resource.
Yes, absolutely. So something else that I thought was really cool too, and this is something that I use, are what are some different apps or websites that people can use during this time to think about like mindfulness or anxiety or different types of journaling apps that we can use?
Right. So those apps are a dime a dozen. There are tons of them out there.
Yes, but some of them aren't very good, and some of them are better than others.
You're right. What we found is that all these apps that are the better ones are backed by empirically supported research. So there is some apps out there that are based on cognitive behavioral science. There's some that are out there that are based on mindfulness research that is also grounded in experimental research. So it has some basis behind it. So long-windedly, some of those apps are, they have Insight Timer, which also provides meditations. One that is out there that I'm a big fan of is Headspace, and that's also by another meditation researcher. There's also another one which is called Healthy Minds, and if we're thinking about just meditation, that's Healthy Minds is also put out by a neuroscientist who has done 20 to 30, I think even 40 years of scientific research.
Wow. So maybe might be trusted, right?
Right, he might be trusted, and so that's available for free, and that's due to some donors that put it out there and have made it available for anybody to have.
Incredible.
Right now. Other ones that are really good at being able to, there's Mood Diaries. Again, there's Senvillo, I think it is.
Yes, that one's kind of like a mood diary as well, I think.
Right, yeah. And so those are good.
Let's talk a little bit more about the one that you enjoy. Why do you enjoy it so much? Or why would you encourage somebody else to get that out?
So Headspace has cute animations. I like the animations.
That's what it is.
But with it, it's grounded in the research in that it takes you a little bit at a time to help you learn the processes of meditation.
Okay.
So that you don't give up. I mean, because one thing is, let's face it, it's hard to get your mind to sit still.
Yes, even for 5 minutes.
Even for 5 minutes. And so it provides you structure. And that's the thing that a lot of us miss is having that structure. It provides structure whereby you can learn a little bit at a time. And to learn how to be okay with your mind going amok. And being okay with the idea that there are going to be times that your meditation is not going to be good. And there have been many times that I have sat down and I've thought, I don't want to meditate. This is ridiculous. I hate this. As I went through it, there were times that I didn't do too well. But it's not about how well you do at meditation. It's about the consistency of just doing it regularly every day. You're going to have some great days, and you're not going to have some so great days. So I'm a big proponent of meditation, in that it can help us to be able to control our emotions, especially during this time when things are so uncertain. And the thing that we can most rely upon is change, because things are going to continue changing. And by practicing meditation, you learn how to accept change, even if you don't like it. And so that's why I'm a big fan of it, of Headspace. It provides you that medium to be able to learn a little bit at a time as you're going. But I'm just a big fan of anything that can help us get moving too. So recently, Planet Fitness came out with an app that's...
Yes, I already downloaded it.
Right.
I'm very impressed with it. I downloaded it today, so it's not like I was doing anything at work. Can you imagine? Talk about embarrassing yourself.
Right. But at the same time, it's there. It's available. So what I love it is that there's a lot of other resources that different organizations have put out there for free to be able to help us out. A couple things that also help us out are different apps that can help out with exercise. Different apps that help you like kind of monitor your movement. Different apps that help you kind of journal your everyday activities. One of the most robust things we found about improving behaviors is keeping track of your behaviors. So sometimes just habit tracking apps can help you out. As long as you're consistently doing it, you will see that your behaviors will improve. One of the things that we have found in terms of we don't want to spread any germs, and I've touched my face a couple times, but if I didn't want to touch my face, one of the easiest ways is to keep track of how often I touch my face. And we found that the more people keep track of how long they touch their face or how often they touch their face, they touch their face less. Now what's interesting though about that is also once you stop keeping track of touching your face,
you're going to go back to doing it?
Back up to it, yeah.
I'm going to tell on myself here as a marketing professional. Whenever I first started doing radio, and even now with podcast I do it, and I could show you on this paper, I have a really bad habit of saying so whenever I begin sentences, and you will notice this now that I've told you. So every time I say it, see I just did it again, every time I say it, I mark it down. Or I'll write a 1 and then I start keeping tally so
Uh-huh.
that I stop myself from using that word because I think it's very redundant.
Exactly.
But whenever I stop doing it, I continue to use that word again.
Uh-huh.
So now you've just answered my question for myself. So I need to start keeping tally again.
That's good.
Yeah, so really this is my own clinical psychologist show. So thank you for answering and solving my problems.
You're welcome. You're welcome.
No, you did mention something earlier that made me think about how whenever we seek help, it's not a handout. It's a hand up. So all of these free resources for us shouldn't make us feel bad because they're given to us for free for a reason. Because somebody has felt that it was important to have these resources out there for free.
Uh-huh.
And I think we should take advantage of them.
Yeah, definitely. I like the phrase that you said. It's not a handout, it's a hand up.
Yeah, absolutely. We should all be working as a community to connect and help one another. So it's never a handout, it's never charity. It's always, let me help walk alongside you and make you a better person because it's going to make both of us better in the long run.
Right. And it creates goodwill. So in the future, if I do need to seek services, I'm more likely to go to that person who has given me a hand before.
Yes, because they didn't also make you feel bad for it. Because they just wanted to help you, because they care about you. And that goes back to what we talked about earlier, creating those relationships because you're connecting with somebody. So it's really genuine and authentic, especially during this time where everything is so tumultuous and we really don't know what tomorrow is going to bring. Whenever we're forming those connections, I think we know at least who we can lean on.
I'll say one thing that we haven't talked too much about, but I guess we have, is service.
Mm-hmm.
We have found that when people are in the service of other people,
Mm-hmm.
they often feel good about themselves, and the good feelings that they have last a lot longer. So even if you have, for example, if you were to win the lottery, and you were to give your money away to someone else,
Mm-hmm.
you'd feel better about yourself giving that money away
Versus keeping it?
versus keeping it and
Wow.
engaging in activities. And that feelings that you'd have, the positive feelings that you'd have, would last a lot longer too.
Isn't that amazing? But we don't think about that.
No, we don't. We don't often think about that. But those people with whom are regularly engaging in finding novel ways to serve other people, particularly during this time when we're supposed to engage in social distancing and, or physical distancing, as I like to call it, they can still provide that service. A text to a friend, uplifting video, or whatever means to be able to help them out. Or if they're having to go out shopping to get the necessary elements for that day,
Mm-hmm.
and they know that a friend down the road might be running low, they're able to get some of the groceries for their friend and then just drop it and leave it at the doorstep, and then that's it.
Yeah, and that really does mean a whole lot to one person, which is really cool. So something that I thought would be really cool to talk about too are the positives to note with COVID-19. So we've talked a lot about all the negative repercussions, telehealth visits, how we can help as Phelps Health, and kind of what you're doing on your end to help all of our patients in our community. But what are some of the really cool things that have come out of COVID-19?
Communication, talking with one another. There's also a sense that a lot of kids, and I talk about kids because I'm around kids a lot,
Mm-hmm.
There's a shared language that they have with their parents. There's a shared language that they have with their peers with whom they get to talk to on a regular basis. So this shared language can allow us to be able to unite together. Other things that that are positive about COVID-19, some parents are able to spend more time at the home with their kids. They're able to slow down a little bit. They're able to have home-cooked meals. Research indicates that those people who have home-cooked meals with each other at a dinner table usually have better self-esteem. They also view themselves more highly. They also have better social interactions with other people. So that's another positive that could happen. Other people are breaking out board games too. And so they're engaging.
You know, that could be causing trouble.
Right, and it can be.
Depending on what game you're playing, right?
Exactly. Friendships can start and end.
Yes. No, the game that friendships start and end with is always Monopoly. It always starts with the best of intentions.
Exactly. So being able to play games with each other, being able to start new hobbies.
Mm-hmm.
Some people are actually engaging in hobbies that they had said that they were going to do for 20 years. and now they're actually doing it.
Like physical fitness.
Like physical
I've
fitness.
noticed all of
Yeah.
the gym equipment, you cannot find it. It's like it never existed.
Exactly. When you go to the store and you try to look for it, it's not there.
Yes, it's all gone because everybody has decided this is their time. Nobody is going to see them for months.
Right.
Whenever we come out of COVID-19, they will be a new person.
Exactly.
Yes. Or they will have hoarded all of their gym equipment so now they can sell it for some money.
Exactly.
Yeah. It's a good investment at least, right?
Exactly. Yeah.
No, I think you hit on some really good points here. Something I really think is important too is that most people are good.
Right.
And we've seen this time and time again in our community, and I know I've mentioned this a couple of times, but Rolla has really come together to support not only the community, but really to support Phelps Health, and to let our frontline workers know that you are loved, you are cared for. We know that you are out there on the front lines caring for potential COVID-19 patients, and we really support you.
Yeah, definitely.
And that's really cool. So we're kind of wrapping up here and nearing the end of our show, but I want to give you an opportunity to speak to our listeners if you'd like to.
Sure thing. Disruption to our daily lives is a great way to develop new habits. We often do not know what to expect during times of uncertainty. What we can expect is that uncertain times change, and those expectations change along with them. Curiously, some of what our listeners may learn is that we can jumpstart new habits because there are no expectations. All we can expect is the unexpected, and unexpectedly, we will be doing new things that have potential to help us cope, grow, and thrive.
Thank you so much, Dr. Rackham. I really appreciated having you on the Scope podcast today. You nailed it on our first run, I think. So thank you so much to our listeners. You've been listening to the Scope podcast with myself, Paige Heitman, and Dr. Rackham. If you liked our show and want to learn more, check out phelpshealth.org. Join us next time when we talk about allergies, the flu, and COVID-19. Thanks so much.